Hi, I'm Irene from the University of Calgary. This screencast goes over the foundational knowledge that you'll need before using ultrasound. In this screencast, I'll go over how sound waves are generated by the ultrasound transducer, how an image is generated sonographically, a little bit about commonly used transducers, and basic knobs and instrumentations that you'll need when performing ultrasound. So first, how does an ultrasound machine work? What many ultrasound devices have in common is a transducer that relies on having a layer of crystals in its transducer. These crystals exhibit what we call a piezoelectric effect, which is to say that when they are subjected to electricity, they're capable of generating sound waves. Sound waves within tissues are really just mechanical pressure waves that result from the vibration of particles within the tissue, and this results in changes in pressure over time. We describe the properties of these sound waves based on their frequency, the number of cycles of acoustic waves per second. The higher the frequency, the more cycles per second, as shown here, as opposed to a lower frequency with fewer cycles per second. And by way of context, the threshold of human hearing is a max of 20,000 hertz, whereas ultrasound devices we use are typically in a range of 2 to 20 megahertz. So even the lowest ultrasound sound waves frequency there, which is 2 megahertz or 2 million hertz, this still far exceeds the human hearing threshold, hence the term ultrasound. Transducers both transmit sound waves, and once it encounters a structure, some of that sound waves will be reflected back to the transducer, which also serves to receive these sound waves. The transducer then converts this sound energy back into electrical energy and then display that information on our ultrasound screen. And as each crystal along the scan head transmits and receives information, it's going to then display this information on the screen for us, pieced together like so, giving us an ultrasound image. In essence, when you put the transducer on the body, it creates a slice in the body and displays the structures on the screen for you. As you can see here, this is an image of an internal jugular vein in the sagittal plane. Here is a transverse image of the right side of the neck, and in this view, it's similar to what you would see in a CT scan where you're looking up from the patient's feet. The thyroid, in blue on the screen there, is located medial on the patient, shown on screen right. But as you can imagine, you can generate a slice however way you want. And here you may potentially be looking down from the patient's head. And in this cut, the thyroid would be expected to be on the screen left. So in order for us to know which image is being generated, all transducers have a marker or an indicator on the transducer. And this marker lines up with the dot on the screen. So when it does so, it allows us to determine which way we're looking at the image. And in this case, you can see that it's as if we're looking up from the patient's feet. Whereas if the transducer was flipped, with the transducer marker this time pointing to the patient's left, the transducer, the dot on the screen is still going to be on the left-hand side, which corresponds to this dot over here on the left-hand side. It then effectively tells you that you're essentially looking down from the patient's head. It's not always easy to see where the indicator is on the transducer, and each manufacturer has a different way of marking that indicator. So when in doubt, instead of just tapping on the transducer, which could damage the crystals, place a little bit of gel on one side of the transducer, and the side that lights up or shows up on the screen is the indicator side. Now, for most point-of-care ultrasound imaging applications, except for cardiac scanning and except for when we're doing procedures, in general, we adopt the radiology convention, where the dot on the screen is located on the top left side of the screen. And with this convention, for the majority of applications, the transducer marker is commonly turned towards the patient's head or to the patient's right. Now that you know how an image is generated, let's talk a little bit about the different types of transducers that you may encounter. These three are the most commonly used transducer in POCUS. They're respectively called the curvilinear array, the phased array, and the linear array. They're also sometimes referred to as the abdominal probe, the cardiac probe, and vascular probe. What's important to know is that both the curvilinear and the phased array transducer are low-frequency transducers, while the linear array is a high-frequency transducer. You can often see the actual frequency range of a transducer listed right on the transducer itself. And the transducer ranges tend to be in the neighborhood of what's listed here on the slide, but not exactly the same. But in essence, low-frequency transducers allow sound waves to penetrate deep, often in the range of 30 centimeters or more, while the linear transducer generally is reserved for shallow and superficial imaging, often and very seldom deeper than 10 centimeters. A good rule of thumb is that anything greater than, that you need to image greater than 5 centimeter deep, think about using a low frequency transducer. So now that you're ready to start scanning, what are some of the knobs and buttons that you need to be familiar with on your machine? What I tell folks is that using ultrasound is like driving a car. Every car is slightly different. There are different ways of turning the car on. There are different ways of turning on the windshield wiper. But the basic functions are more or less the same. You just need to find them on any given car or any given machine. So for ultrasound, there are really 5 functions you need to know. The 2 of these I'm not really going to cover, which is turning the machine on and selecting the transducers and presets. Probably best to look at the owner's manual. Most of these are relatively easy to figure out as well, although occasionally it's challenging to find those buttons. But once you've figured out how to turn the machine on and select the transducer that you need, there are really only 3 functions that you need after that. Specifically, let's start with gain, depth, and then the third one is not critical for you to know, called time gain compensation, but it really is a nice to know function. So what's gain? What does gain do? It amplifies or decreases a signal that comes back to your transducer. So in this clip, gain is being decreased right now to make the image darker. And right now, gain is being increased to make the image brighter. A good rule of thumb is that fluid and blood should be black and anechoic, and that gain otherwise should be enough for you to really look at and see the structures that you're interested in. The next function you need to know is depth. Depth will make the corresponding image bigger or smaller. As you increase the depth, the structure will look smaller. And as you decrease the depth, the image or the structure will get larger again. In general, you should start deep so that you're not going to be missing far field structures, and then decrease the depth accordingly. Add a centimeter or 2 beyond the lowest border of the structure that you're interested in, so that the structure you need to see isn't hanging out at the very bottom of the screen. So here are 2 clips of the same kidney, one with more depth than is necessary, so the kidney of interest is now quite small, and the image on the right has a more appropriate depth so that you can see the details of the kidney a lot better. The last function I'll discuss is called TGC, or time gain compensation. It's not a critical function to know, but it really is an important and helpful function, especially for optimizing your images. Now, time gain compensation may be represented by slider buttons like that's illustrated here, or sometimes in some machines it might just be 2 knobs. Either case, what it refers to is that the top part of the sliders or the button controls the near field, which is at the top of the screen. The bottom buttons or the bottom sliders control the far field, which is at the bottom of the screen. And any sliding of buttons or turning the knob to the right will increase gain. And in this example, only the near field gain is increased. Whereas sliding the button to the left will decrease gain. So in this example here, only the far field gain is decreased. So when is it useful? Here's an image of an IVC, or inferior vena cava. What you'll see is that at the far field, due to signal attenuation, the image quality or details are much harder to look at in this inferior vena cava when the time gain compensation is even. However, when I increase the distal gain, so the far field is increased, you can actually see a lot more details in the far field. Here's another example where it might be helpful. Here's an example of a bladder, and what you'll see here is that because of decreased attenuation, there's really a lot of enhancement posterior to the bladder, making everything quite bright. You can improve this image by decreasing the distal gain, which then allows you to see the posterior structures a lot better. Here's another image of a bladder of a woman where the far field gain is decreased, and you can see that the posterior structure is a lot easier to see by decreasing the far field gain. So these are the basics you need to know before using an ultrasound machine. It's really helpful to understand how an image is being generated, and it's really critical to know which transducer to use. Anything superficial should be using a linear transducer. Deep imaging should be using a low-frequency transducer, such as a curvilinear or the phased array. And to use any machine, you need to know how to turn it on and off and select your transducer and presets. But once you've done that, the critical functions you need to know is how to adjust gain and depth. And if you're willing to learn it, time gain compensation will go a long way in helping you optimize your images. And thank you for tuning in. Please check out the SIMUS website for more videos. The QR code is listed on the slide here, and that leads you to our website. Thank you.